Hindi lang dito sa Pilipinas, kundi sa buong mundo. Inanunsyo po ng Pangulo na siya ay magbibigay ng pabuya ng hanggang 10 milyong piso sa kahit sinong Pilipino na makakadiskubre ng vaccine laban sa COVID-19. Pinapaanunsyo rin po ng ating Presidente na siya po ay magbibigay ng isang substantial grant sa UP at sa UPPGH para po makadevelop nga ng bakuna laban dito sa COVID-19. Binibigyan linaw din po ng Presidente na ang kanyang binanggit sa huling talumpati niya ay para tumulong at tawagin ang AFP para nga ipatupad po ang ating ECQ. Wala pong illegal dito. Sang-ayon po sa desisyon ng ating Korte Suprema, ito po ay ginagawa ng lahat ng administrasyon, tumatawag sa AFP kung kinakailangan na magpatulong sa AFP. Gayunpaman, ulitin ko po, sa ating salig ng batas, merong 3 extraordinary kapangyarihan ng ating Presidente bilang Commander-in-Chief ng Hukbong Sandataan. Ang pinaka-less intrusive ay ang tinatawag na calling out powers. Ang susunod po ay yung suspension of the privilege of writ of habeas corpus at ang pinaka-draconian ay ang martial law po.
You could cure the coronavirus by using an anti-inflammatory. Just like my point. So I would like to suggest that for researchers to look for this site and the people around this, because I do believe they are in the right direction. So many are discussing different antiviral drugs, which is good, and there are also a lot of antibiotics which we already have. But sometimes we forgot that there is also what we call the antibody reaction. So the antibodies should also be controlled. Not only the viruses, not only the bacteria, but also the antibody. So research will not just focus on virus, antiviral, or antibacterial, but it should also focus on an antibody. So my proposal is actually, if we could make an antibody, but specific only for the coronavirus antibodies, not for all the antibodies, so that we can make an adult person like a young kid again by removing the antibodies that was created by the ordinary coronaviruses which he was exposed at the first, so that when the true virus comes in, the 2019 comes in, the lungs will not overreact and the patient will just develop ordinary signs like flu, just like he is a kid. So if there can be a research, I would like to ask researchers to focus on an antibody focused only, not for all antibodies, only for the coronavirus's antibodies that a patient could take even prior to the illness. So for example, in an area that there is an epidemic like in China, it would be good that people around can take something that could lessen the antibody reaction in case they get to inhale the coronavirus. Because it's not really the virus that kills the patient, but it's the overreaction of the antibodies that kills the patient. Because it's happening inside the lungs. And 5 minutes of less oxygen, it can already destroy your body and it can already kill you. So therefore, it's good that there will already be a prevention for that severity. And could it be that when the patient got the virus, that you could increase the dosage perhaps of that antibody, so that the reaction will not become severe. So I'm thinking of inhaled drugs, because inhaled drugs goes to the lungs directly. But of course, I'm thinking of IV drugs in oral forms. But I'm thinking of an antibody focused for the coronavirus antibodies. But of course, not for other antibodies. And there have been millions and billions of money poured on this disease, and I hope you could put some studies on this one. An antibody specific for the coronavirus, which could be given earlier prior to the infection, and it can be given higher dose during the infection to prevent the severity. Okay. Now, I would like to continue on with the discussion on the immunization. So I just want to highlight in this study, the immunization with SARS coronavirus vaccines, this is dated 2012, leads to pulmonary immunopathology on challenge with the SARS virus. There's a potential that the patient can even become severe if you give the vaccine, just like was given on the mice. Let me give you an example. If I give a vaccine to a patient with about coronavirus, so then I induce some antibodies there. But what if, because there are 7 types of coronavirus, what if a coronavirus comes in and there are already antibodies that was stirred up by the vaccine? What can happen? It can develop severe reaction because the antibodies were generated specific actually at the lung area as well. So the question here is, if you make a vaccine, should you also include the other coronaviruses? Because there are 7 coronaviruses. So the question is, should you include all the other coronaviruses in one vaccine, or the only COVID-19? In a sense that antibodies can really play a big role. It's like the more antibodies, the more the reaction, but the less antibodies, the less reaction with regards to the coronavirus, because the attack or the event happens at the lungs. I do believe that if coronavirus doesn't really do well at the lungs, like just anywhere, any part of the body, this is not much of a problem. Because if there are any inflammation outside the lungs, a person can survive. But if the inflammation is at the lungs is where you breathe air. So the solution that I'm thinking of actually is not to boost the antibodies for the coronavirus because the fight is in the lungs, but rather to prevent the overreaction of the antibodies. After all, the virus is just a virus which passes by. Because the nature of a virus is that it just goes to your body and it just goes away. Just like the ordinary flu. Without antibiotics, without medicine, it will just pass by. But if the reaction is severe, then the reaction is the one that we have to take care of. So again, vaccination, just don't rush vaccination. I really suggest that you have to study it very carefully using the old researches made on SARS vaccination, and we should prevent severity from happening if we induce immunopathology. Okay, and then finally, I would like to discuss on the management. So how do you manage as of the moment? Because when the lungs overreacts, you can no longer breathe. And then after a few days, the patient dies. Many do some intubation, but the problem with intubation is that even if you intubate and place the patient on the machine, if all the part of the lungs are swollen or edematous, still, even if with a tube, the oxygen doesn't function well. So I'm thinking here of an outside lung. while the virus is still attacking and the antibodies are reacting at the lungs, we need an outside lung. It's like a dialysis. A dialysis with regards to kidney, it's like an outside kidney cleaning the blood. We also need an outside lung, removing the carbon dioxide and giving the oxygen while the lungs are severely swollen because of the reaction of the antibodies with the virus. So what we have actually in this world, what we have is the ECMO.